to Free Advice Friday, or as Dr. Murphy likes to call it, Freak Show Friday. And today we've got a lot of really good questions that you guys submitted. This is kind of how it works. You submit your questions online or call us, or if you're a patient, come in the office. Let us know your most burning questions. And this fella right here is going to answer for free. And the reason that's important is because his time is much more expensive than mine. And I don't know a whole lot of anything. So this is a really good thing for you guys, so I hope you take advantage. Your first question, Dr. Murphy, if you are ready, sir, is this. What should you do if a person around you is choking?
Heimlich maneuver.
Do you want to tell us about the Heimlich maneuver?
Well, you're choking. There's a thing called the epiglottis. It's actually a valve, but a lot of people think it's a flapper valve, but it's really not. The way when you swallow, you have an epiglottis that covers your trachea, your windpipe, and when you swallow, it actually moves up, has a hood, and covers it. But you get a piece of food trapped around it, and it prevents the hood from wanting to close. So a Heimlich maneuver, or a slap on the back, you've seen doctors slap people on the back. What that does is it causes a lot of pressure inside the chest because you have a lot of air here, and it blows it out.
Okay.
Heimlich maneuver.
So, and the Heimlich maneuver is like right about...
Well, you got to get underneath the diaphragm, and...
So it's kind of like where the rib cage, feel for their rib cage, right about a thumb under that?
Yes.
So if you guys see, my rib cage ends here, so you'd want to kind of, do you want to stick your thumb kind of in a knot?
You don't have to stick no, you don't stick your thumb in a knot. Just put your hands around it. I mean,
like
just you put your arms around the person, and just give it a real quick tug.
Tug, okay. So you'll want to probably be behind them,
It's
right?
Air pressure, yes.
Okay.
You be in front of them.
Like
I don't care. Just get air pressure and get the lung to force the air out.
Okay.
That'll blow the piece of food out or whatever's trapped there.
Okay. My husband Dave actually has a really crazy story. He knows a person who's like 7 foot tall, no kidding, just a big guy, real tall. They were out to eat. He was choking, and Dave couldn't get around him. It was really awkward. And he didn't realize, and this is a cool thing, that you can actually have someone bend over the back of a chair and do kind of the same movement.
Yes.
And so if you have a friend who's choking in front of you.
Well, the other thing too is even on when people are drowning, you know how they push on people's chest? Throw them on the floor, push on their chest.
Okay, okay, cool.
Anything to get air pressure out of the lungs.
And what about for babies?
Slap on the back.
Slap on the back?
Yeah, just gentle percussions.
Yeah.
They'll choke, they'll spit it up.
Okay.
Infants, it's actually easier than...
Because they have shorter...
No, it's the way they're shaped.
Oh, okay.
Babies' windpipes are actually shaped like a V.
Yeah.
And so they have a tremendous amount of air pressure coming up. But it's much easier to get a baby to stop choking than an adult.
So this is silly, but I used to be a lifeguard, and one of the things they taught us is if you can open the mouth with the baby and see the food, don't go digging down the throat, but if you can see the food and just a real, like with a pinky, something very gently, scoop it out, would you recommend that?
Yes.
Okay.
Yes, I would.
All right.
And I have done that before too.
Oh, that's scary.
Yeah.
Yeah.
And you know, even I remember one time at St. John's Hospital in Joplin, Missouri, when I was working in the emergency room, they were flying in a guy that they were trying to intubate, put a tube into their lungs, and they couldn't get it on the way down, but they had a bag mask and they were doing everything correctly. But you don't move a patient until they're stabilized. And so I actually literally went out there and put my hands, my fingers down his throat, felt his windpipe, knew where it was by feel, and stuck the windpipe in. So to get him to breathe. But yeah, you can do that.
Very cool.
Yeah, I mean, so fingers work fine.
Okay.
Yeah, and don't worry about it, pinch it, do whatever you need to do to get that person to start breathing again.
All right.
Absolutely.
Okay.
There's no wrong thing.
Okay.
Nothing.
Except with babies, maybe? Be a little more careful with babies?
Not really, Michelle.
Okay.
I mean,
because I mean, if they can't breathe, that's
they're going
the
to
biggest
die.
problem.
Yeah, they're going to die. So you really can't do anything wrong. And if you do the CPR courses, they tell you, 3 taps on the back, throw them over, 3 taps on the chest, and you can do all kinds of crazy things. Open their mouth, check the airway, check them for breathing, scoop, and, observe, but just keep doing it. They will eventually cough it up.
Okay. So the big thing is feel empowered to make a decision and do something.
Act.
Act.
You can do no wrong.
Okay, so
None.
in a choking situation, get after it.
Can do no wrong.
Can do no wrong. So get it done, because if a person can't breathe, then that's it. You know?
Yes.
Okay, well,
Do no
hopefully
wrong.
you feel empowered enough to make some choices the next time something like that happens, God forbid.
Yeah, you can look it up on Google too. I mean,
Yeah.
I'm sure there's pictures. I've never
Yeah.
seen them. I've never done it, but looked it up on
Yeah.
Google. But I'm sure there's pictures. I'll show you how to do
Okay.
it.
All
Be
right,
fine.
we'll look those up.
Yep.
All right, awesome. Well, that was a great one. Very good. So the next question, what should you do if you come in contact with another person's blood or saliva?
On how? That's
That's a pretty broad question.
it is. I mean, is somebody bleeding on me? Do I have an open wound?
Well, I don't know. I guess there's two scenarios.
If somebody has blood and puts it on my skin, nothing.
Nothing's wrong.
No,
Okay.
I can't get any contagion.
If you get it in your eyes, in your mouth, or an open wound, what do you do?
That's
Or
a
some
little.
different color?
Yeah, and it really depends a lot. I mean, you really can't get, because we're worried about HIV here and hepatitis and a few other crazy things, but HIV does not last in the air, in the saliva. It's relatively non-existent. So if somebody coughs on you, spits on you, and they're a known HIV carrier, it's relatively impossible to get
Okay.
HIV disease. But if you were to get their blood on an open wound, that's possible.
Okay.
To-
Not incredibly, serious.
Odds 1 in a million.
Okay, so if it's blood, it's a little more serious than saliva, but still.
Relatively,
Harmless,
yeah.
Okay.
They all are. Probably the only exception is hepatitis A. That's a pretty common
Okay.
one to be transferred through hand contact, saliva, spit. Hepatitis B, not so much. That's usually what they call a blood-borne virus.
Okay.
HIV is pretty much blood-borne.
Okay.
I'm trying to think of the other ones. Flu, tuberculosis, those are all saliva, aerosol, viruses and bacteria that can be propagated through that. But not so much if you had tuberculosis and you coughed on a open wound. You can't really get TB from that,
Yeah.
but you can get it from inhalation.
Okay.
So it's a poor question. It's a good question, but it's a poor question because there's
Yeah.
so many answers to it.
Okay, so there's a lot said. So if you have a more specific question about maybe a certain instance that you can think of, that may be something you come encounter with, or you encounter, let us know.
Yes.
But otherwise.
That's too broad.
Pretty broad.
Yeah.
So here's a weird question. What about those people who wear the face masks at the airport or in public? Is there anything there that is preventing any illness?
I don't think so.
Yeah, that's kind of what I've wondered. It doesn't seem like a real great.
It's a barrier, and honestly, I think we avoid those people because we don't know if they're
We think
infected.
they're sick.
Yeah, they're sick, and that's why they're wearing the mask. Go, I'm gonna stay the hell away from them. So, no, there's probably some to it, and I think if you looked at the research, those people are less likely to get infected because everybody avoids them because
That's
they think
hilarious.
they're sick. Yeah, but is overall. Does that mask, that particle mask, that was a doctor's mask that we wear in the ORs,
Yeah.
does it actually filter out much of anything? The answer is maybe a little bit.
Yeah.
The interesting thing in the operating room, the one thing that actually filters out a lot of bacteria is the head bonnet.
Oh,
Around the hair.
Oh, okay.
Yeah, that's why we wear those a lot.
Wow.
Around the hair, around the beard. If a man has a beard
Yeah.
like me, we'll wear a bearded
Yeah.
mask. But that's where a lot of bacteria hang out, is on
Wow.
our hair and our beard.
Well, that's interesting.
Yeah, but it's not so much the breathing component.
Yeah, okay.
Yeah.
All right.
Now, if you
Well,
sneeze, it's 100-mile-an-hour wind. Yeah, it'll go through it.
Okay.
So-
Well, so then I guess those are just a little weird.
They are very
Mostly,
weird.
I get real freaked out when I see one for sure. I'm like,
I know, you go to Japan and China, and they're like everywhere.
They do,
Yeah.
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 Yeah, but they're so densely populated. I don't know.
I can't say something.
I'd be wearing gloves and.
I'd be like a biohazard suit walking
Gosh.
down the streets of Tokyo.
No kidding. I think that sounds stressful personally. Ugh. I don't like being around that many people in one space. It freaks me out.
There's a lot of stuff.
Ugh. I'm a little bit of a germaphobe.
No.
Just a little bit, yeah. Okay, so I guess, again, if you have a more specific question, let us know. Otherwise, there's lots of different variations there
Yes.
and lots of things to keep in mind, but probably safe unless it's maybe the spit or the cough with some of the more, okay. All right, perfect. So, third question, how long should you take off work? This is probably another broad question. If you've been, you know, diagnosed with the flu or some other type of sickness, you know how people are like, when do I go back to work? So that you don't get other people sick. What is kind of the guideline on that?
Yeah, I'm gonna throw this out there, I'm gonna float it. It's a rule of thumb that I've followed over the years. Flu, strep throat, pink eye, blah, 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 3 days.
Okay. So, but you're also probably contagious before you realize it too, huh?
You are.
Okay, so you've probably already gotten some people sick, but
Yes.
stay away.
And typically, I would say on average, maybe 3 to 5 days beforehand. But when you have full-blown symptoms, flu, fever,
Yeah.
blah, 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 you're contagious for at least 3 days.
Okay.
Strep throat, if I start you on antibiotics, you're contagious for 3 days. After 3 days, you're not contagious.
Yeah.
Pink eye, same thing. 3 days. The children with the pink eyes or
Yeah.
the knots on the side of their head, 3 days.
Okay. So
After
that's a good rule of
not,
thumb.
not contagious.
Okay. So I guess if you do come down with something, that gives you some.
Yeah.
Try to get sick on Thursday, get a long weekend.
Yeah, yeah. You'll be fine by Monday.
Yeah.
Now, you might still feel bad, but
Yeah.
you are over it.
Okay. Pretty good guidelines then, huh?
Yep. 3
Okay.
days.
That moves us on to our next question about ear infections. I feel like we've had a lot of people lately come in with ear infections, but it seems like nobody really understands that that's what's going on. I mean, heck, even kids, we've had kids come in and their parents don't realize that's what's going on. Do you have kind of an idea of what to give them in terms of symptoms maybe to help them diagnose themselves? So if they do come in, recognize they have an ear infection? Not really?
Well, with children, it's pretty easy. They tug at their ears because they hurt, and they're wanting to dig at them and try to relieve the pain, which is there. You really don't see that many ear infections in adults other than swimmer's ear, which is an infection on the outside in the canal. Okay, because we get into water that's contaminated and it doesn't leave for whatever reason and has an infection. But ear infections in adults are actually relatively uncommon.
Oh, really? Okay.
And it has a lot to do with what they call a eustachian tube, which is a tube that connects between the middle ear and the back of your throat, which is straight back through here near a gland called an adenoid, which is like a tonsil kind of hanging back there. But it opens it up, so when you're going down a hill and you hear your ears pop, that's the pressure equalizing from the atmosphere to the middle ear. And in adults, it's usually very open, very patent, so it works really well. In children, the anatomy is such that the canals are really stretched long and tight. It's a thin canal. So when they sneeze and they backwash fluid into their ears, they can set up an infection. When you grow up and get older, your eustachian tubes actually, your posterior pharynx, the back of your mouth, grows towards the eustachian tube. So your tubes get shorter, fatter, bigger.
Okay, so less opportunity.
That's why you grow out of them.
Okay.
That's why children have tubes in their ears to drain the fluid out. Because if you have fluid in an ear, can't really get antibiotics to it very well because it's contaminated fluid in my hand. How can taking antibiotics cure that fluid? It can't.
Yeah.
You have to get rid of the fluid. So they put a tube in the ear to drain the fluid.
Wow.
And in certain situations in adults, they actually do put tubes in their ears to correct that.
Wow, so it's kind of rare in adults though.
It's very rare in adults. I mean, adults can get, they get fluid in their ears from allergies.
Okay.
So, and it doesn't necessarily get infected, but they can get fluid, so it feels like an ear infection. And so you can get some pain radiating down your jaw on both sides.
Or anything like that?
Yes, you get dizziness, pain radiating down your jaw. You get spinning of the earth, like we talked about.
Yeah, so that was a different thing.
It is. But the nerve that actually innervates the jaw runs through your middle ear.
Okay.
So you have to be careful when you're putting a tube in there, you don't pierce that nerve. Otherwise, you make your whole jaw numb.
Oh no, that would be terrible.
Yeah.
Ooh.
And that does happen.
Oh man, okay.
So
for adults, it's pretty rare. So if you think you have an ear infection,
yeah. So children pulling at their ears, tugging at their ears, running a fever, have their doctor check them out.
Okay, pediatrician.
Yes.
Okay, perfect. All right, I guess that answers that question. So now we're moving on to our last question. And this isn't too crazy. I didn't have any too crazy questions this week.
Thank God.
I know, we're gonna give Dr. Murphy a break so he doesn't
I
just
need one.
like explode. Your last question is, what do you think is or are the most misdiagnosed issues in medicine?
Probably flu, strep throat, allergies. They're really confusing because there's a lot of overlap with them.
Uh-huh.
And so that's probably the number one thing that I see. Number two would be back pain, whether it's a disc problem or not a disc problem. In other words, there's an operated issue or a non-operated issue.
Yeah.
Number one, two number one things, complaints in a doctor's office in the United States are headaches and low back pain.
Yeah.
Every doctor has seen it. I don't care what kind of physician you are, you would have seen this. But headaches, they're a little bit on the tough side, and I've had a few tough ones recently, trying to figure out exactly what's causing the headaches, and there's a lot of overlap with all this stuff, and it can be really tough to figure it out. You know, a lot of people come in to the clinic and they say, well, I have back pain because I have a bulging disc. Well, here's a fact. If you took 100 normal people walking down the street and we put them through an MRI, a scanner that shows the disc, 25% of them will have a bulging disc. But they have but they have no pain. So what does a bulging disc mean to me? Nothing.
Okay.
So, but upper respiratory tract infections, flus, viruses, allergies can be really confusing.
Yeah.
So those are tough.
Okay, so it is good to, if you think you're having issues with any of those types of things, to go in and see someone to make sure you get it figured out and.
Let's see a good caring doc.
Yeah.
Yeah. To see a doc that actually cares about you.
Yeah.
You know, sits down and talks to you and doesn't treat you like a number. Yeah, I get so disgusted with physicians. I really don't like doctors that much. I don't.
Yeah, just yourself.
Do you know of any doctor friends of mine? I have one or two.
Yeah, not a whole lot.
Yeah, well, I've been around here for 30 years.
Yeah.
Yeah, I really can't stand any of them.
Well, I agree though. I mean, I think it matters. And I mean, I know you do this, and this isn't us just trying to pitch you, but Dr. Murphy will sit down with his patients, and I feel like.
All day long, for as
Yeah.
long as it takes.
Yeah, and I think that
And make sure you're
really
comfortable
matters.
with what I'm talking about.
Yeah.
And if you're not uncomfortable, I don't have an issue with that. I really don't.
Yeah. You know, and I think just kind of going back to the misdiagnosis, I know for sure, if I get a sniffle or anything, I don't know what the heck's going on. So I immediately go down to Walgreens and I just get, $100 worth of random stuff and just try to figure it out on my own. And I wish I would just, and now that I'm, here most of the time, I can just walk in and say, hey, Dr. Murphy, what the heck's going on with me? But I think a lot of people just go to Walgreens and try to treat themselves, and maybe that'll work, but if you can go in and see a doctor and make sure you get what you need and take care of it the right way, it'll be fine. I think a lot of people do that, don't you think?
I think you need a brain biopsy.
I think I do too. The things I need you can't get at Walgreens, that's for dang sure.
We'll have to use a microscope.
Yes, you will. Knock. It's like that SpongeBob episode where it's just like a bunch of little SpongeBobs running around in there. That's what it's like in my brain. All right, well, that wraps up our free advice Friday.
Play whack-a-mole with you.
You kind of do. Yeah, you kind of do. I really wish your brain was like that. That'd be kind of cool, having a bunch of little memes running around inside there telling me what to do.
Lord Jesus.
Or like on Men in Black.
Stop
the little
already,
tiny
will
dude
ya?
in there, right? Just kind of driving me around. I'm just an alien man. So, all right. So that's everything this week. I hope you guys have a great weekend.
See you next Friday.
See you next Friday.